as far as helping patient to look good non-surgical. I hope I don't ever have to have a surgery, because I just don't want, I mean, I have had surgery, I have had rhinoplasty and a couple other things, but hey, if I can stick with my neurotoxin and prevent having permanent line, why not? If I can do some fillers to maintain my youth and not look sad, why not? And then if I can do some treatment to like improve my skin quality, why not? So I told you guys, always remember that. Prevention is like baking a cake. You cannot just do toxin and thinking this is it. You have to let your patient know at one point, if you just stay with Botox or just neuromodulators, something will go wrong, and I will tell you what will happen, okay? Let's give you guys an example. This is a great picture as far as why doing fillers at one point, it's a must. So when you're looking at the forehead, it's in this page, I think it's the third page if you go on. One more, yep, one more. Okay, right there. And then one more, and then one more. Yes. All right, so fat pads. So we do have two different fat pads. We have superficial fat pad and we have deep fat pad. So superficial fat pad compartment and deep fat compartment. So if you want to think about it as a cake, the first layer is your skin. The second layer is the superficial fat pad, and then is the muscle. Below the muscle is deep fat compartment, and then the bone structure, right? So what do you think based on this picture here? This is like easier to see, but this is the daughter, this is the mother. What has happened to the fat pad if you look at it? This is the daughter, this is the mother.
It looks like it's gotten thicker or
descending is one.
Sagging.
Exactly. So two things happen to our fat pad. One, they deflate. Two, they descend. When I say deflate, the reason that mom in this picture looks sad is because of two reasons. One of the very main reason is our deep fat compartment, which is sitting above the bone, does one thing and one thing only. They give you support. So imagine you have a pillow and you start taking all the fluff out. What's going to happen to your pillow?
flat.
Exactly.
Plates.
Exactly. So a lot of people think this area, I look sad. A lot of people think, okay, let's do some toxin, let's do some Botox. And the rationale behind that is, the reason it's because we have a muscle right here, depressor angular oris. Do you see this muscle? And I can show you more better on my app. Where's my phone?
Somebody took your phone.
Oh, somebody took my phone. It's okay. So, it's okay?
I have it.
You have it? So depressor angular oris, this muscle does one thing. When little kids want to make their sad face, what do they do? What do they use?
Mm-hmm.
Yeah. Exactly. Yeah. And that's one of the muscles that we used when we were little kids, because we want to make that little sad face. So depressor angular oris is one of the area right there. There you go.
Depressor anguli oris.
Right there. This is a muscle that has one job and one job only. Fade others. Do you see that?
Mm-hmm.
Here, I want you to look at it too. So one of the area that I told you guys that is off-label that a lot of providers use is injecting the DAO. Because especially in some people, this muscle works a lot. And imagine there are two guys sitting here and they're constantly pulling downward, right? So by placing 3 and 3 units of toxin, what do you think is going to happen to that muscle? Relax it. So if the muscle is going down, by relaxing that muscle, we're gonna stop that muscle from going down. Therefore, it's gonna stop doing this, right? So that's one of the area of doing Botox or toxin that is considered off-label, but it's something that is super important to get it done. Because as I said, mainly a lot of people focus on the mid-face, upper face, or lips, and they completely forget the patient has a lower face. I would say I challenge you, like in the next couple weeks, look around, especially women in their late 40s or 50s. They look perfect here or extremely overly done. So when we're talking on the lower face, your DAO muscle, it's so important. Jillian, I think I have a couple extra copies. If you just give them a copy of this, it will be helpful. It's in the second option, it's on the bottom. Or you can just make a couple copies of that. So your DAO, it's an area that we can do toxin. And the way you can do the assessment is by just putting your finger here and have the patient make the sad face. And you can feel it. Try it on yourself. Do you feel it? A little bit?
Yeah.
Yeah. All you need to do is inject 3 units of Botox. And the beauty of this treatment is like basically we're telling that muscle, hey, calm down, stop going downward, okay? So the reason I told you guys you have to educate your patient that why it's important to not only doing toxin, why they have to do filler. So again, if you are looking at this patient and you're looking at your fat pad compartments, what do you think? I mean, this is like, let me see if this picture is better.
Well, I had it done to myself.
Yeah,
so
oh,
I'm a
yeah.
filler.
So basically, we're trying to give cushion to that area, the pre-gel sulcus.
It definitely brings you back.